welcome back to Women Making Moves, where we celebrate the moves that women are making. My name is Amy Pons. I'm founder of Unlock the Magic Coaching and Marketing and an energy healer. I'm joined today with Hiba Siddiqui. Hiba Siddiqui is a 21-year-old community education and health advocate as she explores how to improve healthcare access and tackle disparities in underserved communities. A recent summa cum laude graduate in health science and medical Spanish interpretation, Hiba brings her knowledge of cultural competency to the forefront, offering insights on how communities of color can advocate for one another. As the founder and CEO of Sahi Incorporated, she's passionate about raising awareness of cardiovascular health within the South Asian community and beyond. With hands-on experience in translational cancer research, particularly in breast, bladder, and prostate cancers, Hiba is dedicated to making healthcare more inclusive for all. Hiba, welcome.
Hi, Amy. Thank you for having me on.
Healthcare inclusivity for all. I can't help but think immediately to the fact that, I don't know if you say women's anatomy or female anatomy wasn't added to medical research, scientific research until 1993.
Yeah, that is correct.
A lot of
Yeah.
people don't know that and are also still like outraged or shocked by that. How do you find that that's well known?
I actually don't find that that's well known. And I think that it's interesting because when you see the human skeleton, it is typically depicted as the male human skeleton in specimen labs, in cadaver labs, in anatomy labs all across colleges and university campuses. And people don't really recognize that female and male anatomical skeletons and formations of bones and the way that they're arranged are different in men and women, and they're actually different and used in like forensic science and anthropology to identify victims of different crimes as well. And it's really interesting to see that women anatomy actually wasn't a part of American terminology in terms of the way that we go about in education. Yeah.
And further, more women die in car accidents because crash test dummies were again based on male bodies and not women's. Didn't
I didn't know that, but that's
ah,
interesting.
just added in the past couple of years.
I can see how that would play out just because, like you said, our anatomy is different. And it's not just different skeletally, but just the way that our bodies kind of carry muscle in different places, fat in different places. And for the purposes of, being a woman, carrying a child, you have fat in your lower abdomen. You have muscle in different places, and that really just affects your body composition, the way that it's overall shaped, and that can cause injury, in terms of these car accidents.
So we got a lot to do. We got a lot to catch up. Tell us some good news. Please tell me it's not all doom and gloom because, like, I toe the line between being angry about that stat, about how we weren't added till 93, but also, and I find joy and hope and optimism for women like you, humans like you, that are not only aware, but are like catching up. So, what's the good news on that front?
I think the good news is that although there's always so much more to learn and there's always so much more growth to be had, that women being now more predominantly in healthcare in like nursing fields, physician fields than before have made significant advancements in the way that we go about procedures, in the way that we establish patient comfortability, the way that we establish healthcare practices, cultural sensitivity. And women have brought a lot to the healthcare forefront in terms of more empathy, the way that we approach patients, the way that we guide patient care, the way that we may see different or multiple treatment options in different ways from a different lens. And that has really broadened the medical sphere. That's broadened our understanding, and it's allowed us to seek more treatments in different ways and also an advocacy of women patients, of female patients themselves. It's easier for a female doctor, a female nurse to be able to see the point of view of a female patient undergoing traditional women problems than it may have been for a male physician. And that's remarkable.
And do you find even a step further that women from different parts of the world have different composition as well?
Actually, yeah, it's a great point that you bring up that because that's almost entirely what my nonprofit's based on. Coming from a South Asian background and a South Asian heritage, I've done a lot of research on cultural predispositions, genetic predispositions, and how the way we were born, the culture that we were raised in has really impacted our health and has really driven health decisions for so many generations. And in terms of women particularly, there's so many cultural factors that impact the way that women go about caring for their own health. In the Indian community, particularly the one that I've grown up in myself, women are typically given the role of being the homemaker or the caretaker. And that's been a traditional role in many cultures as well. And we tend to, as women, put all this pressure on ourselves as homemakers, as caretakers, and we don't recognize the stress or this anxiety or this cumbersome load is always affecting us. And we've just kind of learned to just deal with it. And that has had so many health consequences. For example, with cardiac health, which is what my nonprofit's based on, women's symptoms for cardiac health are vastly different in the way that male symptoms can be presented. So male symptoms are characterized as being chest tightness or the left side of your chest pain, grabbing your left arm. That's typical heart attack symptom. But for women, that's presented as indigestion. And that's presented as bowel problems. That's presented as tummy issues, digestive issues. And that's pretty typical of, women undergoing menstruation, women undergoing their own digestive issues once in a while, but they can't differentiate between that and a life-threatening issue. And that's what's so sad. The fact that as women, you have a tummy problem and you're like, oh, it's just one of those days or something I ate or, just on my period. Especially women who have a genetic predisposition to heart issues. It's easy to ignore those symptoms and say nothing's wrong. It was just a normal day and it was a pain on a scale of 2 and I just went about my day, but I had a massive artery blockage and I didn't even know about it. And the way that heart attacks are marketed in some cultures are chest pain, or it's hurting, it's killing me, it's in the center of my chest and I'm holding my arm and I'm feeling it everywhere. But for women, that may not be the case. And I find that so interesting, just in a sense that those symptoms are just so different across two genders and are more tolerated in a way by women just because of the cultural standards that have been placed on us.
It's kind of amazing how much we as women just accept as discomfort in our day-to-day life. It reminds me of so many conversations I've had through this show and others that there are so many saying, I no longer accept this. I'm going to create something new and different and step outside that box. And it's like uplifting each other and making sure that we have room and space to grow in that, to say, without being dubbed just like a mad woman or hysteria and things like that. It's like, no, we're just not okay with being uncomfortable anymore, to the point all the way up to having life-threatening complications within our health. And wild fact is tomorrow I'm actually going in for a CT calcium scan because my doctor's wondering if I'm starting to show heart disease symptoms. So
I'm really sorry to hear that. And it's just like, this is the type of thing that these preventative measures, these screenings are things that should be advocated for women. And they should be present in our earlier lives, in our young adulthood, in our childhood, in, our developing ages. And especially like when you consider the differences between men and women have what physicians call a natural protector of heart disease, and that's estrogen. And estrogen's a hormone that allows your vessels to be flexible and allows them to kind of move a little bit more, have more flexibility when blood flows through. And once women hit that age where that estrogen level just drops and plummets dramatically around menopause, your risk of heart disease is increased by a significant amount. It's interesting because you don't see those symptoms up until that point. But once that point hits, it might, even be too late sometimes. And that's the importance of regular screenings. That's the importance of advocacy for heart health in women. That's the importance of dietary measures, dietary advocacy, fitness advocacy, all these other things.
So my doctor, I'm 42 and I went for my annual physical, and my doctor saw something in my blood panel and she said, ooh, let's do a preliminary. I want to see if you have any kind of early signs, or you're showing some early symptoms or early signs of heart disease. And I want to understand where we're at. That's why I'm getting the scan done. And I'm pretty certain it's my diet. And so I know that there's going to be vast changes coming once we get these scan results, but I'm grateful that she's like something along with your age. I'm heading into likely perimenopause or in it already, that she's like, let's do something proactive about this.
That's a great, I mean,
Yeah.
that's see that's such a difficult but a rewarding thing to hear in a sense,
Yeah.
because a big change has to come with that sort of thing. And that's difficult as being the person having to, gone your whole life without really needing to worry about this sort of thing, or also because it's not really as advocated for women. It's not a mainstream thing for women. And, going your whole life not hearing this, and then all of a sudden, a big change has to be made. And, it's so much easier for the healthcare system to kind of, like I said, paint these typical symptoms as being the real symptoms of something when they're actually more showing of how these symptoms are expressed. So, knowing that beforehand would kind of like prepare you, would allow you to make changes earlier, would allow you to understand earlier. Besides changes, just understanding, that's a whole thing in itself, the education, just the awareness. And
Mhm.
that's so important for our community.
Yeah. What she saw in my blood panel was a sharp increase. So again, I feel like it's ahead. I'm hopeful, but again, it's like, well, I'm going in for a heart scan tomorrow at 42. Like, okay, we're going to take it as it goes. And I'm grateful to have the means and resources to be able to get the scan done. I have a nose piercing and I had to get like a glass retainer for it because I can't go into the scan with metal, of course. So
Oh
anyway.
yeah. Mm-hmm.
So, one of the things that really struck me when I met you for the first time was how, as women, we can really get involved with the communities that look like us specifically. And I'll speak for myself. What I now know that I was earlier in my days, especially in corporate, I was a really awesome white feminist, meaning I wasn't taking into account all of the lived experiences from all different kinds of women. I was really advocating for white women. And I refer to myself as a womanist. I'm taking into account all women. And what I felt resonant with you on is that first and foremost, the first barrier was like getting women into research. The second is that you advocate for South Asian women, but then even further than that, you are intersectional in the work that you do and making sure you go beyond your community. Is there resonance there between what I identified myself as a white feminism now advocating for all women? Is it something similar?
Yeah, actually, I agree. I would call myself a womanist as well, in your words, because like you said, there's so many different ceilings to break,
Yeah.
and it's just never ending. Because the first one is, like women in STEM. Although we're getting there, there's still so much more advancement in, technology specifically, mathematics specifically, aerospace engineering, like big fields like that, where you don't really see a lot of women. And then there is sort of uplifting and advocating for our own community in that sector. Me having my corporation dedicated to South Asian heart health and providing education and awareness on that. That's been particularly personal to me just because I identify with that.
Right.
And then, like you said, I feel like my job isn't done in a sense that advocating for a certain group of women is really beneficial for the short term in a sense that there's so much that you can allocate for a specific group, a very niche group. But in the long term, expanding beyond that is what the real goal is. And I think I've tried to immerse myself in engaging with other cultures through different means. And by that, I mean, I pursued a concentration in my degree for medical Spanish interpretation. And I think particularly for my background, my heritage being South Asian, Spanish wasn't necessarily something that many people pursued just because that language obviously was not a South Asian language. It was not really tied to the culture. It was kind of off-road. And for me, I wanted to pursue that to be able to not only visualize, understand a different cultural perspective, but see how, as a medical professional, I can fit into a greater community. And I think going into medicine, going into this career field, I'm not just going to be advocating for female patients or for South Asian female patients. I will be advocating and serving a variety of patients from multiple backgrounds, ethnicities, cultures, etc. And having lived in Chicago and now living in Boston, living in very predominantly Latino, Hispanic populations as well, I thought it was very important for me to be able to have enough of an understanding to support these groups, especially in the medical aspect where I would be, using my place and my character. And I found so much fruit out of this endeavor just because there were so many things I didn't know. And it was almost like it was learning a culture from the ground up for the first time from an outsider point of view, from someone who's never been in that culture, but seeing where everything comes to play, how it all works together, how it relates to my culture, and how in the end, there's actually more similarities than we think there are differences. Very, very small things. Like I grew up eating rice and beans and tortillas. And I was like, this is a very South Asian niche thing. And just learning medical interpretation for Spanish, I learned how to say these same words in Spanish. And I learned how these same food items impact dietary preferences in Hispanic populations as they do in Indian populations. And I saw those commonalities, that synergy. And I saw so much of my own culture in someone else's culture. And I also started to see their own culture as their own culture. And I think that's so beautiful just because minority populations, we tend to mainly focus our support on ourselves in a sense of advancing our own communities, which is amazing, which is beautiful because it brings so many of our own community together. But I think even more growth happens when we band with other minority, other ethnic communities, other communities in general, and we push each other forward by setting foot into those communities ourselves.
Yeah, I couldn't agree with you more. That's how we ultimately win as humans.
And I completely agree with that. It's one thing to know your privilege and then just sit on it and be like, I understand. And then it's another thing to go out and be like, what am I going to do with this that's going to help other people? That's going to help people around me. That's going to bring other people up. And I identify with that because medicine, healthcare is particularly South Asian dominated in the United States.
Right.
And with this privilege that I have, being a South Asian medical school candidate, and, having so many of my ethnic and cultural peers around me who are succeeding, it's a cultural bringing. I find myself more drawn to using that to help communities that may not be in those fields dominantly. And I say that specifically in reference to, my medical Spanish expertise, because you don't find a lot of South Asian physicians who know Spanish or who know languages other than South Asian languages and English in the United States. And I can say that based on research as well, because I have researched that. And going into a profession where you're going to see so many individuals of so many different facets of ways of life, we have a responsibility to be able to advocate for and be as accommodating as we can for individuals who may need that.
So what moves are you excited to be making right now?
Moves I am excited to be making. That is a very vague, but a good question because I like that it's vague. I am very, very excited to learn more. And that's a vague answer to a vague question because I feel like I learn so much in every single different facet of what I'm interested in. And whether that be creative expression, whether that be my corporation, whether that be research, I love learning and I love growing and I love adapting and I love listening to criticism. And I'm so excited to listen to criticism. And I'm excited to hear that and be like, okay, this is how what I'm doing is being perceived. How can I be better? How can I learn? And how can I advocate better? How can I be a better human, be a better woman? And in that sense, how do I be a better woman by uplifting other women? How do I be a better human by lifting other people up? How do I find my place in society, in this world, as a person of color, as a female? And how do I use that and make the world mine? And I think that's what I am trying to do in being in research, in going to medical school, in growing my corporation. It's just to make an impact and it's to do something that I know I have the potential of doing and impacting people.
To do something, I feel women specifically are on the forefront of creating the balance between the divine feminine, divine masculine that we've never seen in this lifetime. The divine masculine is at high level action, divine feminine creation. We've been only in the action to the point where the past thousands of years, it's become toxic because we're only focused on the action or the doing rather than like what we're trying to create, which is the balance. And especially in the workplace, and I can speak to this from the corporation standpoint, corporate America, it's still rooted in the outdated systems of white supremacy, patriarchy, colonialism, capitalism. So it's like understanding where the roots or origins that many of the systems, many of the average workplaces, I outgrew it. It didn't
Mhm.
fit me any longer because I was not able nor willing to contort and conform to the box, and being the copy paste culture, unsubscribe. So that's where, by any degree, those who are feeling called to create the balance or the shift for humanity, to create the new world, because what was true for, let's say, the traditionalists, boomers, and X, and even millennials, isn't true for anyone after that. And we've got to make room for that space. We've got to make room to be able to create that new world. Otherwise, there will be no one to hand it to. That's why we're all called to each other, like you and me, to say, like, how are we doing this in our own unique zone of brilliance, and how we're contributing to that new way of living and being, and especially in healthcare, we need it. I want to go to a post that you made recently. Of course, we have World Mental Health Day. I can imagine how many conversations you've had when it comes to healthcare, women being understood, believed. Now we're seeing some of the basic healthcare actually becoming illegal for women. How can you talk to that impact on mental health for the average woman who's not being believed, cared for, or in a very real case recently was put in jail because her body miscarried a child? It's enraging, right?
It is. And, I applaud what you said earlier when you said we need to make, it was along the lines of we need to make something of the world so that we know how to hand this off to someone else, how to hand this off to the future generation. And in some ways, I feel like the current political climate is so there's so much going on. I think women's mental health is a very important part of that conversation. With the way that women are dealing with some of these different issues that you've stated, like the different instances, I feel like it's sad. It's very, very sad. As an individual in healthcare, I can't imagine being a professional who can't serve my patient to the fullest extent that I can. And, being a woman myself, I can see myself as both the patient and as a potential physician that I'm aspiring to be. And in both cases, I'm upset and I'm sad. And I find that, this is an issue that there isn't one way to cope with because there's nothing that the individual person can really do in the grand scheme of things. And there has been so much of an effect on women's mental health with the way that women are dealing with this, with the way that this can impact future generations, and with the way that history is really changing the way that we're going about it these days. With mental health specifically, women, we're told of many things. We're
Mhm.
told that, we should express our feelings. We should feel things. And then we're also told, that was a little too emotional. That was a little too this. Why do you have to cry about that? Why does that have to be a big deal?
Or it must be that time of the month
Oh,
because you're
yeah, or it must be that time of the month.
stuck all the way
And,
off.
I feel like there's always something that you just can't do right. You're either told to feel because, you're not dealing with it correctly, you need to feel your emotions, or you're told you're feeling too much. And, why is it such a big deal for you? Why is it that big of a thing? It's not that big of a thing. And that's really sad in today's age. It's important as young women and, older women, young adults, to recognize that that's the kind of culture that we're cultivating, where women are constantly conflicted between whether to feel something, whether to not feel something, whether what they're doing is the right way to deal with coping, to deal with stress, whether it's not. And in the world of mental health, I actually my stepmom is a psychiatrist, and she is a well-known psychiatrist with all of these amazing articles on bullying and hazing and women's mental health, and she is such a huge advocate for mental health in our family. And she's like, you know what? If something's wrong, we got to talk through it. We got to deal with it. We got to work through it. We are seen as equals to everyone else who has the same mental health issues. Everyone is seen as equals when it comes to mental health, and everyone should have appropriate ways and resources to deal with mental health. Same with my dad, who is a psychiatrist as well. I just have a whole mental health family. But there are so many different ways that women should be able to cope. And I would say to women that the best way to go about this is, to seek the most appropriate mental health resources for yourself, to seek therapy, to seek outlets to seek time for yourself. Like I said, we are so focused on everything around us, everyone around us, that we rarely give time to ourselves for our own comfort, our own belonging, our own enjoyment. And we need to just put pause on everything else in life and do what makes us happy sometimes. And that's okay. And there's so much more to say about it.
Well, at 42, I have been in so many instances where I've had a medical emergency and the on-call physician, because again, the workplace, even healthcare, is rooted in capitalism, like how many patients can you get through in a certain amount of time. I wasn't being listened to, wasn't being believed. The impact on my mental health, feeling gaslit about something I know is going on in my body, can feel like some of the worst. So I would say, like, for those women who feel like their mental health is impacted via something that's going wrong, or seemingly something's going wrong inside your body, get a second, third, fourth, fifth, or sixth opinion. Find someone who's going to listen, believe you, and don't ever feel forced to make a decision. Please feel like you're in on the decision for your body. Because again, the gaslighting that can come from personal experience through my healthcare has been really astonishing.
And that's absolutely awful because there are so many women that that happens to.
Yeah.
And I find it very ironic for a physician to be like, you don't feel that. Because how do you
Like
know
what?
what I'm feeling?
Like seriously?
How do you know how do you know how I feel at 2 a.m. in the middle of the night when I'm waking up with headaches, when I'm waking up with this, when these joints hurt, when this is also hurting, when I'm having a mental fog? How do you know what it's like for me? Because you are hearing me talk about it for 10 minutes and you know apparently exactly how I feel.
And I feel like it all goes back to the systems rooted that were never designed with us in mind. That's the how we got here, and the how we go forward is to take a step back on, why did you get into healthcare? Do you care about the person? If that's true, then scale back on the rat race.
I
Unlearn.
completely agree. And the best physicians are those that put themselves in their patient's shoes, that have that empathy, that have that understanding. And I feel like I'm privileged to say this as well because my parents are physicians who are the best kind of physicians. And I've seen that as their daughter. And I've seen how empathizing, how sympathetic, and how emotionally invested to an appropriate degree you can be as a professional to be able to correctly advocate for your patient. And that's how it should be.
Mm. And that's what gives me really good hope that the next generation of healthcare, which is you and people like you that get it, that like we have to come back into the humanities. That's what makes me hopeful as I start to age, that you'll be on my team. So, Hiba, as we start to wind down, what would you say to those healthcare professionals that are maybe old school or new school, that is more about the time is money vibe as they run their own practice or like their day to day with their patients?
I feel like I've had personal experiences with individuals like that. And I would say that there is so much more humanity in a profession, such as being a physician, being a caretaker. So there's so much responsibility in that career that it's important to recognize the level and the amount and the type of education that you have and how that can change someone's life for the better, being used in the best possible way, being used in a way that helps a patient feel understood, feel heard, feel seen, feel cared for, and feel advocated for. And it's our responsibility. It's my responsibility too, as an aspiring professional who wants to be in those shoes, who wants to have that responsibility. It is my responsibility. And I hope to be the one who can be an accurate and calm voice for my own patients, who can see things from their perspective. And if I can't, who can try my best to, and to accommodate and to make changes if I need to in the way that I practice things and to grow in that practice. And, it's important to recognize to those physicians as well that medicine, like many other professions, is not a cookie cutter profession. You can learn everything you want in books and on videos on YouTube and take as many tests as you want and get hundreds on all of them. But unless you know how to apply your knowledge and use the human part of who you are with that knowledge, you're never going to be a successful physician.
Mic drop. What? Yes. Yes. You can imagine that there are humans, incredible humans that have entered the professional healthcare world that feel like you do, and have entered into a practice or an environment that is that time is money and they're getting burnt out. What would you
Mhm.
say to those medical professionals that are in those environments? Where do they even start?
I think as hard as it is to say, and I can't really say accurately just because I've never been in that position and I hope I never will be. But from the outsider point of view, I can recommend taking a step back and reframing how you see everything, reframing your vision, reigniting your passion for why did you go into this in the first place? What was the reason? What am I trying to get out of this? And what's going to make me a better person and a better physician? And taking an ode to that original goal and that original motivation and reframing the way that you go about things. And, I think it's important to always, consider taking a step back whenever things get difficult, whenever things get overwhelming. And that goes for anything. Whenever you're burnt out, you can't think forward. So you need to calm down. You need to relax. Go for a run. You need to go for a mental run, watch your favorite show, watch a rom-com, and come back and reframe the way that you're going about things.
And the answer might be leave that practice. Allow yourself, give yourself permission to wonder about the unknown for a little bit while you find the environment that is going to light you up and that's not going to suppress the way that you're trying to bring humanity back into healthcare or your any profession for that matter. As
Mm-hmm.
a coach, I can say that's what we do is we take a step back, feel into your body, what feels like a hell yes, what feels like a hell no. And that's
Mm-hmm.
kind of the starting point but it's returning to yourself first. Oh, wow. Hiba, where do we find you?
I am most active on Instagram and LinkedIn, and I think those are my two main platforms. I also, through my corporation, am connected to my business account as well through email, so I can also share that information as well if need be. But I am most easily accessible through Instagram and LinkedIn.
Closing remarks as we wrap up.
I feel like there's so much to say, and I feel like we've already said it, but also we haven't even scraped the surface. And I think the whole, I guess, theme of what we were talking about is advocacy in healthcare, advocacy for each other, and putting yourself in other people's shoes and putting yourself in other people's ethnicities, in their backgrounds, in their upbringings, and seeing how we can lift each other up in that sense. And I think that whatever profession, whatever role you feel you fill in life, that the goal is to bring each other up through that. And there's always a way to do that in whatever you're passionate about, in whatever you're pursuing, and in whatever you are currently a part of. And that should be a main goal, if not the only goal in what's happening.
Thanks, Hiba.
Thank you so much for having me. I appreciate it.